All right. Thank you for being patient. This is the Boyce 130 review. Um, and I know you guys have your test next week. I want to start off by apologizing for canceling on Tuesday. My kids had a weather delay and I couldn't get to my office to run my Zoom meeting until after 11. So it would have been after the time that I had allotted for you guys. But I have some time today and we're going to kind of go through this. I will, before I go through, and this is the same review. If you went into the OneDrive shared folder for Boyce 130, this is the same review that I have listed in there for fall. I'm just going to try and change it up a little bit based off of what I have available. But before I do that, I want to quickly review your blueprint. So the blueprint for you guys compared to 110. So you took the 110 test last semester. Now you're taking the 130 test. The 130 test is very similar to the 110 test, except that you have the addition of some more complex dosage calc problems, meaning that it will take you 2 steps to solve. And by that, I mean, like, you might have to convert patient's weight in pounds to kilograms, then answer the question. And the thing that's really new for you, a lot of you, is this right here, which is the flow rate questions. So that's what I'm going to hyper focus on for the first part of this, because that is the new stuff. And I'm going to try and pull some questions from the 220, 230 review type questions, because those are the only types of questions I have available for Boyce. But I always say, if you go on and you watch my reviews that I've done for Boyce in the past on YouTube, they're very campus specific. So, but you can go to anything that's labeled Boyce or BO on my YouTube channel. Look at the 110, look at the 120, 130 videos. Those are the ones to kind of focus on. You can look at 220, 230. You can look at 240. You can look at the Allegheny campus stuff, but just realize that there's a few differences in how they ask their questions, as well as some types of the questions. The biggest difference is at Allegheny campus, they'll say, they'll give you, a parenteral medication. They'll tell you then to calculate the milliliters for the dosage. You need to know that you're looking for milliliters for this. So it'll just say, what is, how much would you administer? That's how your question would be asked. At Allegheny campus, it would be, how many mLs would you administer? So you can basically go through, look at those practice questions, get, and then just kind of, if you're looking at the Word document, you've saved it, delete the way that it's asking the end question. You could still use it as a source for studying. Okay. All right. So let me go back to this. All right. So the way I started looking at this and putting this together was just kind of building off of some of the things that you are going to be responsible for that are very similar to 110. The first two types of questions you're going to get are conversion questions. So you're converting metric to metric, you're converting metric to household. As a reminder, when you convert metric to metric, you do not round your answer, meaning that if I'm converting 25 micrograms to milligrams and you get an answer of 0.025 milligrams, that is your answer. You do not round that answer. You leave that alone. However, if you're going from pounds to kilograms, so let's say I have like 145 pounds, I'm converting that to kilograms, and I get like, 45.454545 repeating, you are going to round that to 45.5 because your instructors don't want this long repeating number. So just keep that in mind. And then numbers greater than 1, round to nearest 10th, particularly for problems that are milliliter based, and then problems less than 1, round to the nearest 100th. So like, 0.25 is an acceptable answer for like a parenteral medication where you're injecting 0.25 milliliters of a particular substance. So we'll go through some samples of that. You're responsible for knowing your conversions. 1 teaspoon is 5 ml, 1 tablespoon is 15 ml, onward, so on and so forth. Some of these things were crossed out just because they were included in the conversions. They're still accurate conversions, except for the 60 drop one. But I have yet to see a CCAC dosage calc question where they ask you to convert pound or kilograms to grams or grams to kilograms. It just doesn't seem like it would be something that you would need to do. All right, so let's go through some of these questions. So I'm going to change some of these questions up. So if you've looked at these before and you're like, oh, I know how to do these things. Well, I'm going to change up the questions here. That way you have a different set here, basically. So I'm going to make this, let's say 125 milligrams. Actually, since I already did that previously, let's make that 375. And let's make this let's make it 12.5 micrograms. And we'll make this, let's say 275 milliliters for solving these things. Now, my assumption is that you know how to do these already. So what I'm going to ask you to do is in the chat, go ahead and answer the first 3 questions here. So I'll know which answer is which because it'll say grams, milligrams, ounces. Send it to me as a direct message. I'll give you a thumbs up if you're correct. And if you're incorrect, I'll give you some feedback on that. All right, great. Looks like you guys are getting these right. So remember, when you're rounding, if it's a number greater than 1, you have to round to the nearest 10th. That was the only issue I think I saw. And remember, you're not rounding these answers. So like this would be as your answer 0.375. Okay, that's your answer. You don't round that. Don't round that to the nearest tenth, the nearest hundredth. Do not round that answer. That is your answer because you're staying within the metric system. Same thing for this one. This one's going to have a lot of extra zeros and it's going to frustrate you because you're going to see 0.0125. And it makes you want to round that number to 0.013. Nobody did that, which is good. Now for this one, this should be, or this is 9.2 ounces. Okay. You would round to the nearest tenth. Where did I get that from? 275 ml. And then I'm going to convert milliliters to ounces. And I know that 1 ounce is 30 milliliters. And then I'm going to get like 9.166 repeating. Okay. Because it's a number greater than 1, you're going to round that to 9.2 ounces. Now, in reality, right, you're looking at this, and you say, okay, well, how did I get to 9 point, or what would I do in a real life situation? In a real life situation, you're giving the person 9 ounces, right? If you're making a recipe and it comes out to 9.2 ounces and you don't have a way to measure ml, you do with a measuring cup. But if you don't, or don't think that you do, and then you do a conversion, not that you're doing this, but you would just you probably put 9 or even 10 ounces and you'd be close enough, right? But when it comes to medication, you want to make sure you're being as precise as possible. And then you can argue whether or not that involves rounding. Now, someone said they had a concern about how to do the micrograms. So let's work through that one real quick too. So I have 12.5 micrograms, and I need to convert micrograms to milligrams. Now, some of you are moving the decimal types, right? So I'm going to move this 1, 2, 3, and that's where I get my 0.0125 milligrams. But if you don't feel confident moving the decimal, then you would just set it up like this, right? So you have micrograms and you have milligrams, and you know that 1 milligram is equivalent to 1,000 micrograms. And so you're just going to put into your calculator 12.5 divided by 1,000, and then you're going to get your answer of 0.0125. So if this is something that A, you missed on the 110 test, or B, you always sometimes get it right, sometimes you get it wrong, you need to practice these and practice setting them up. You need to know either how to move the decimal, or you need to know how to set up using dimensional analysis. Because I did the exact same thing, going from milligrams to grams, divide by 1,000, 12 point, and then going from micrograms to milligrams, divide by 1,000. It's the same steps. All right, let's look at a couple other examples here. I'm just going to change these. You guys can do these on your own. And then I want to get to the flow rate questions. That way you have an answer. So when you come back to this, or if we have time, we get back to this, just remember to, you just have to remember your conversions, right? So a teaspoon is 5 ml, tablespoon is 15 ml. Converting pounds to kilograms, 1 pound is 1 kilogram is 2.2 pounds. So to kind of keep that in mind when you're doing those things. And then if you only have memorized, anytime I'm converting pounds to kilograms, I just divide by 2.2. That is correct. That's exactly what you're supposed to be doing. All right. And then this, you probably remember from doing last semester, you're just converting ounces, pints, quarts, cups to milliliters to get to what you want. So just to kind of create a little bit of a dynamic here. So as always, so someone asked about rounding. If it's a number greater than 1, you round to the nearest 10th. If it's a number less than 1, round to the nearest 100th. All right, so these are the new things that you're going to start to see are these flow rate questions. So I'm going to, like I said, I'm going to change these up, and I'm going to give you some variations of this, and we're going to start with this one. All right, so let's make this, let's say 400, and let's make this over. All right. So when we do flow rate, what we're looking at, so this is relatively new. You may or may not have seen this last semester. You may or may not have seen this on ATI. A lot of times this is your first time kind of diving into it. But with the flow rate, what we're looking for is we're trying to calculate, because this even tells you what to do, but you may not get that told to you. So if it tells you what would you set the rate to in the infusion pump, you need to know that that means what is the ml per hour. Okay, that's what you're looking for. So what is flow rate? Flow rate is volume measured in milliliters over time measured in hours. The reason this question typically gets missed is because students are looking for some sort of math to do, but there is no math to do other than reduce. So I'm going to take my volume over my time, and then I'm going to reduce 400 divided by 5, and I would set the infusion pump to 80 milliliters per hour. So I'm going to give you another option. Let me just copy and paste this real quick. So, and then I'll give you another problem to try just to make sure you got it. So let's say it was 200 milliliters, and then it was 1.5 hours. So I'm adding a little bit of complexity here, but what would I set the infusion pump to if it was 200 milliliters over 1.5 hours? Go ahead and put your answer into the chat, and then we'll see what you get there. All right. So if you're doing this and you're following your rounding rules, your answer should actually be 133.3 milliliters per hour. Now, I will say this. If it's me, most likely you're going to put it at 133 milliliters per hour. But because they give you specific rounding rules to round to the nearest 10th, and you have a decimal there, the more precise answer is the 133.3 milliliters per hour. However, in reality, you probably won't be able to set it to the 10th if it's something that's a number like that. But you can have decimal milliliter per hour in your dosage calc answers. Okay. So a lot of times this is what happens when I write up a question off the cuff. Okay. And then I get the a number that doesn't equal outright. So like if I had said 200 milliliters over 2 hours, then you'd just be like, oh, okay, it's 100 milliliters per hour. Perfect. Okay. But technically you should have 0.3 in your answer. but my assumption is that you won't have to worry about that because your answer should end like this, the 80 milliliters per hour. Let's try a question like this. So I'm going to change the numbers here just a little bit. So give me a moment. That way you have a fresh question. Now, the thing that's different here is instead of giving you the time in hours, it's actually giving it to me in minutes. Okay. All right. So this will be a challenge. So go ahead and do this first one. I'm asking you to calculate the flow rate in milliliters per hour for an infusion or a tube feeding of 240 milliliters in 40 minutes. All right, good. So I'm getting some answers and I'm getting some variations in the answers. So let's go through this question and work through it together just so you can kind of see. So what this question is asking you to do is to convert milliliters per minute to milliliters per hour, right? Because it gives me milliliters and then it gives me a time, but this time it's in minutes. So what I'm going to do is I'm going to just set this up as 240 milliliters over 40 minutes. Now, I will say if you got 6 as your answer, that's 6 milliliters per minute, but the question says how many milliliters per hour. Okay. So before I do anything, what I'm going to do is, and what I'm going to encourage you to do is make sure you are converting minutes to hours. Okay. Then when you do this, you're going to take into your calculator 240 times 60 divided by 40, and you're going to get an answer of 360 milliliters per hour. So I saw that going around, but I also saw 320, I saw 363.3, I saw a variety of different answers. And so let's just kind of break that down. So let's say you did 240 divided by 40, you get 6, multiply by 60. I'm not sure how some of those other numbers were coming up, but my guess is, unless some of you were answering the second part of the question, the 500 mil, 15 minutes, and we'll get to that in just a second. But for this question up here, you should have got an answer of 360 ml per hour. All right, so I'm going to go ahead because I think some of you already answered this one. So I'm just going to go ahead and go through this one. So let me just see here. Maybe not. Maybe those are just some of the different answers. All right, so I don't think anyone got this answer yet. So go ahead and for this question for the 500 milliliters in 15 minutes, what would you set the infusion pump to in milliliters per hour? Okay, good. More of you are getting this one right. Perfect. Okay. Yeah. So for this one, you should be getting 2000 ml per hour, and you guys are getting it. Now, if you're sitting there going like, holy crap, that's a lot of flow in a short period of time. Well, that's because over an hour, yes. But will they be on the insurer for that entire hour? No, because the 500 milliliters, which is like just about 2 cups or a little bit more than 2 cups. I'm sorry, a little bit more than, oh no, that was right. A little bit more than 2 cups of the drink in 15 minutes. That's no problem. A lot of you drink a liter within a matter of minutes. If you're really thirsty, right? You've downed a water or other drinks in a very short period of time. And so this is not outrageous, although the number seems ridiculous, right? All right, try this last one here, and then we'll move on to the drop factor questions. So the 750 ml in 4 hours, what would you program your infusion pump for that? Good. I'm seeing it consistently. Now, I said, you may not like this answer. And like I said, I think they'll clean these answers up when you actually have your test. So you won't have to worry about like a decimal answer where you're thinking like, should I round that to 188? It might be the most accurate in a clinical setting that you would set that to 188 or even 190 mil per hour. You may not even be able to set it incrementally by ones. But when we're in, I always call it the CCAC math bubble. You're going to round your answers to the nearest 10th. The only time you don't round to the nearest 10th, or the only time you don't round, is when you're doing metric to metric conversions, like we did at the beginning of the review. So going from milligrams to grams, going from micrograms to milligrams, and vice versa. You don't round, and you can't give someone a partial capsule. Okay. And then, so someone said that their professor said we can't have half of a milliliter. I would confirm with that, because yes, you can, because that's easily seen on a syringe. So I have a feeling that's just a miscommunication. Because yeah, you can give a quarter of a milliliter, you can give 100th of a milliliter, you can keep breaking it down. Okay. Now, good. So someone just said, well, what about drops? I didn't get into that yet, but drops, you can't give someone a partial drop. So I can't give somebody a drop and a half. I either give them 1 or 2. I can't give a partial drop, just like I can't give someone a partial capsule. And you might be thinking, yeah, you can open that up and put half into, your oatmeal or whatever. Nope. That you're not getting 50% of the medication when you do that. Tablets are scored and could be cut in half because they have a uniform complexity, but capsules cannot be given as partials. But really anything else technically could, because you can just keep breaking it down. They have, you've actually seen this. If you've, I know in your coursework, you've studied like blood, and that a lot of the blood is measured in deciliters or microliters when they're looking at different things like your white blood cell count, or even some of the vaccines are like in a micro dosage when they do it. They just use a smaller syringe. Okay. All right. So let's get into drop factor. All right. So when we do drop factor, what that really comes down to is you have it now set up. It's dripping into the patient's IV, and it's on a drip. And then there's tubing associated with it. And in this setting, you have basically, it's almost like a secondary unit that's just adding drops at a time. So you might see this associated with like morphine, or in this example, they're saying gentamicin, which is a type of antibiotic. Okay. So what I'm going to do is I'm going to tweak this a little bit. Let's say they want to give him or the patient 75 milligrams. And then what we have available is 150 milliliters, and it's infusing over, let's say, 35 minutes. We'll leave it at every 6 hours. The drop factor here is going to be 5. And then the question says, what is the flow rate? Now, if this is the first time you're seeing a question like this, instinctively you're thinking, okay, flow rate, we already know is milliliters per hour. Great. But anytime they introduce this thing called drop factor, okay, that tells you that you're going to be calculating for drops. And the way that we convert and look for drops, we're basically asking you to convert milliliters per hour to drops, abbreviated GTT, per minute. So 2 ways you know you're dealing with a drop question. It'll give you a drop factor, or it'll say the word microtubing. If it says the word microtubing, you are expected to know that that means 60 drops per ml. Okay, that's the other thing. Drop factor means, this means GTT per ml. That means it takes 5 drops per milliliter. If you've ever used like a dropper, like maybe use like a dropper, like to drop like antibiotic in the eyes or the ears, a lot of times they'll tell you to put like 10 drops or 5 drops or 7 drops. A lot of times those are standardized, so that way you can get to an answer that is or get to a quantity that is considered the milliliter equivalent of that many drops. Like I use as a supplement, I have vitamin D that comes in a dropper. And so if I do 10 drops, that's supposed to be I think 10,000 IU of the particular vitamin D that I use. Okay, so you can use a dropper, and the droppers can be settled. Okay, now this question a lot of times will get missed because you'll try and use some of the extra information that's listed in here. But before I get into that, and I see a number of you are answering, so I don't I haven't written the answer yet because I didn't do it yet. When we're going from milliliters per hour to drops per minute, there's a very specific set of sequence that we'll do. We're going to go from the flow rate, which sometimes is milliliters per hour, but sometimes it's milliliters per minute. Okay, we're going to multiply the flow rate by the drop factor, and that will give us our drop rate. Okay, so what is my flow rate? My flow rate is volume over time. Okay, what's extra is, do I care about the strength of the medication? Yes, because I want to make sure I'm administering the correct medication to the patient, but I don't care about it from the standpoint of doing math. Does it matter every 6 hours? Sure, that absolutely matters. But for right now, we want to know what we're setting the infusion pump to right now. Okay, so I'm going to take my 150 ml over my 35 minutes. Now, instinctively, because we just practiced this a couple times, you're going to want to convert minutes to hours. Because your answer is going to be in drops per minute, don't do that step. It's not necessary, okay? If it's in hours, you have to convert it to minutes. If it's in minutes, leave it alone. What's my drop factor? 5 drops per milliliter. And then you'll know you've done it right. This is one of the reasons why I like to show students dimensional analysis, because then we can see that we're crossing out and we're left with drops per minute, exactly what we're looking for. So I'm going to take 150 times 5, which gives me 750 divided by 35. And I'm going to get some crazy number, 21.42857. Now, I have a feeling that this would be asked in a way that you wouldn't get a number funky like that. So if I'm following the rules for rounding, I would round to the nearest whole drop because I can't give someone a partial drop. So I would say 21 drops per minute. Okay, because you didn't pass the threshold of 21.5 where you would give them 22. However, I have a feeling that, or actually, I know definitively that when they ask these questions, it usually ends on a very solid answer, or it's something like 22.9, and then you're like, okay, it's 23, or 24.1, so it's 24. Okay, but for this, if it's me, I'm going to round this to 21 drops per minute. If you put 22, I think you could argue it, but I also don't think that the I don't think that the um, that you would get a question like this anyways, where it would be ambiguous as far as the answer. And then someone asks, so the 6 hours do not matter? Correct, because the flow rate is volume over time, and then we're just going to continue that flow rate or repeat it every 6 hours, because the gentamicin is going to be done in 35 minutes. All right, so here, let's try another one. Let's change this up a little bit. So I'm going to leave it at 45 milligrams since we already know that doesn't matter. I'm going to change this now to 75. I'll keep this at 25, and I'll make the drop factor, we'll make it 10 this time. All right, so if you have something like this, what would your drop rate be? Good. Yeah, so someone asked me about the microtubing. Yeah, it's 60 drops per milliliter, ml. That drop factor is drops per milliliter. Drop rate is drops per minute. Okay, good. So everyone's getting these right. Perfect. So 30 drops per minute. You're getting it right. Good job. Perfect. All right, let me see if I have another flow rate type question with milliliters per hour. Oh, you know what? I need to give you a two-step problem too. So give me just 1 second. Let me find that. All right. In the event you get asked to do a two-step question, um, the two-step question just means that you're gonna have to account for weight, and then solve like you would typically solve. So let's look at this example here. Okay. So it says the MD writes an order for ibuprofen, 3 milligrams per kilogram body weight, every 6 hours for pain for a child. The child weighs 73 pounds. Pharmacy dispenses you with a 50 milligram per 2 ml ibuprofen. So let's just make sure we clarify that. And then it says how many ml will you administer per dose, or how much would you administer, what might be the other answer. Okay, so step one, and why this is considered a two-step problem, is step one is you got to convert pounds to kilograms. And then step two is solve for ml. So step two is what you've always done with your parenteral medications. It's what you've done always with your tablet and capsule-based medications. So let's do this one. We're going to take the 73 pounds. We're going to divide that by 2.2. And we're going to get 73 divided by 2.2. It's going to give me 33.18 repeating. Okay. I just want to show you something real quick, which we would round to 33.2 kilograms. However, this might change the answer. So I'm going to show you one this way, and then I'm going to show you the way that I think is more accurate and encapsulates what you're supposed to be doing with this. Okay. Although it probably will work out the same way. So if I use that 33.2, then the second step is, okay, now I need to account for the patient's weight, and I need to incorporate that I'm going to give them 3 milligrams per kilogram body weight. And so that's going to give me 99.6 milligrams. Now you know what to do from here because you've done this 100 times. The order in a roundabout way or in a long way is to give them 99.6 milligrams. You could even say 100 milligrams. But if we're being very, very precise, we're going to do it this way. We don't want milligrams. We want milliliters. 250. So 99.6 times 2 gives me 199.2 divided by 50 will give me 3.984. Okay. So if I'm following my rounding rules, right, that's going to cause my 9 to go up. So those of you that are telling me 4 ml, that's exactly what I would say too. If I'm plugging this into my calculator, and let's say I don't want to take a break from the, like I don't want to chop it up like I showed you, the way I would do this is I would type in 73 or whatever the patient's weight is in pounds divided by 2.2 times whatever the milligrams per kilogram is. So in this instance, it's 3. Okay. Then I'm going to multiply by 2 divided by 50. And when I do that, I still get the same answer. So even though I rounded before, and then now I'm rounding again, or if I wait to the very end to round, I'm still getting the same answer, 3.98, still getting the same answer. But you do need to pay attention and be extra cautious when it comes to doing that with pediatric type of questions, because peds, the details matter. The fact that you might be dealing with a smaller, like an infant or a toddler, then you don't want to overdose them. So it would be important to know that. All right. The last one that typically, and you saw this last semester, and I don't really have a way, well, I do have a way to change the answer, so just give me a second. So the way this is asked is just this came from a textbook. So the way you would really ask this question is, we're going to get an order. I'm going to change that order. And then you're going to look at your reconstitution label, and you're dealing with reconstitution label for a variety of reasons, but we're going to get into that here in just a moment. So before you start answering anything, let me change the order. That way, you know that you're doing it the right way. All right. So what I'm going to do is I'm going to change this order. So instead of 0.375, we're going to make this 0.650. Okay, grams. Now, anytime you're dealing with a reconstitution, a lot of times it's not going to just say, this is a reconstitution question. You're going to have to know that it's a reconstitution question based off of a couple things. So first of all, it's intramuscular. Intramuscular tells you it's an injectable, which tells you you are looking for ml. So the question ultimately is, even before you look at anything else, is how many ml are you administering? IM, SC are all going to be ML based. If it's and then SQ, if you get yeah, I already said SC. I'm sorry, subcutaneous, intramuscular. Those are going to be, now IV can be ML, but IV can also be ML per hour. So you would be looking for a rate if that were the case. So this says that you have 500 milligrams of this medication that you've been ordered, but you know you're looking for ML because you know it's an injectable. Okay. So when you see that, when you see like that, you have listed here 500 milligrams and there's no like 500 milligrams per 1 ml per 5 ml or anything like that. That's how you know you're dealing with a reconstitution type question. When you know you're dealing with a reconstitution type question, that tells you to look in and at the directions there that are on the side, and you need to look at it and read through it to look for, really you're just looking for the milligrams per milliliter. Okay. So if you're looking at this, and then if you go onto the shared OneDrive folder, I have put examples of other reconstitution labels so you can have an idea of what they look like. So like there's Kepzol, there's cephalexin, there's Ancef, there's Pfizer Pen. There's a variety of different what are considered reconstitution labels. And then you can kind of see that you have to look in the back of the label, as it were, to find out how to do your conversions. Okay. But basically, it's going to tell you a couple things on the label. It's going to tell you the usual adult dosage range. So 250 milligrams to 1 gram every 6 to 8 hours. We have been ordered 0.650 grams every 6 hours. So that's within that range. Okay. Because you, hopefully, you know that's 0.650 grams is the same thing as 65 or 650 milligrams. It'll tell you to add some water for the injection, shake well. And then what you're looking for is this right here. You're looking for it to tell you what the addition of water makes your concentration to. And once you know that, now you just solve it like you've done any other parenteral medication question. So I'm going to convert this to 650 milligrams. And I'm going to divide by 225, multiply by my quantity. And then it looks like a number of you are getting 2.9. So let's see if that's the right answer. 650 divided by 225. And that's what I get to. You get 2.8 repeating, but you would round your answer then to 2.9 milliliters. All right. So those are the highlights to kind of focus on for the 130 test. I just wanted to make sure I covered all those. Like I said, this is recorded. It'll be uploaded to YouTube later today, probably after 4, depending on when I finish up with my reviews. I think my last review is scheduled up until 3:30. And then I'll have that up later today or this evening. But I still have some time here. Do you have any questions, question types that you'd like to see, things you'd like to review again? you can either unmute, raise your hand, or just type it into the chat and we'll look at whatever you want to look at.
I got one, Dr. Red.
Go ahead.
For the questions that when they're asking you to add up like all of the when they're asking you to add up all of the like the fluid ounces and stuff,
Yes.
can you just go over one of those real quick?
Sure. So I'll just point it to you because I changed the numbers on this. So all you're going to do is convert each thing into milliliters, add them all up, and then that's your answer.
Okay,
So
thank you.
you're welcome. So what I'll say is go ahead and do this one real quick. And real quick is, I know it's going to take a little bit of time, so don't feel like, I'll put it into the chat.
Now, what if there's a problem like with something that you may think is like a fluid ounce, but it's not? Like, I don't know, maybe like, I don't know. Would you consider gelatin? Would that be or
Jello
like
is
like
liquid.
pudding
Yeah.
or something?
Yeah. So
Okay.
anything that can melt and become liquid seems like that would be the kind of the baseline. And so here, if you look in the review section where it talks about, wait a second, where is that? Thought I had that here. Oh, you know what? Let me add this because I know it's in this other review. Give me 1 second. That way you can see it. Because I was like, wait a second, I talked about this earlier. Closed the wrong thing. All right, so I'm adding this to the kind of the review section here. Let me just do this here. So right here, this is probably a good review of what's considered liquid and what's not. Juice, water, milk, ice chips, which apparently if they give you ice chips, if it tells you 8 ounces ice chips, you're going to just record half of whatever they tell you. Drinks, Jello, broths, ice cream. But the reason you don't do fruit cocktail is because it's predominantly solid, right? It's the fruit, and then there's a little bit of syrup in there. And then chunky soup, same thing. It's predominantly like the meat, pasta, potatoes, whatever's in there, and very little broth. But if it was like tomato soup, then that's liquid. Okay. Popsicles can melt, sorbet can melt, ice cream can melt. Jello, if you've ever made Jello, it's just you're adding a lot of water to a little bit of powder and it becomes gelatinized. If you haven't made that, now you know how Jello is made. And so that's why they tell you that it's considered a liquid, even though it's a very, very small amount. So I think the trick to this is, yes, you need to know what is considered a liquid and what is considered a solid. And then hopefully this that I just added here will help you out because it helps me out without knowing all the details, but they might try and trick you. I don't think that they're going to. I think the biggest trick is, do you remember how to convert pints, quarts, ounces, cups, all that kind of stuff to milliliters? And if you can, then you should be good. I hope that helped.
It did. Thank you.
Okay, you're welcome. All right, and I did not work out that question. So someone said they got 1215 ml. If anyone wants to confirm or deny that, because I want to go back to the reconstitution question because that was asked. I just want to give you another reconstitution question to work through. And let me find another example real quick. All right, so I'm going to add in another example of a reconstitution. Trying to get to. All right. So let me clear out some things here. All right, so I'm going to change this up and I'm going to make this be, let's just say 375 milligrams. Hopefully you can see the label. I know it could be a little bit challenging, but if I give you this, go ahead and see if you can solve. If you can't see it, just say I can't see it, and I'll go ahead and work through it. But this would be another reconstitution question. So see what you get. You're looking for milliliters. Okay. All right. So looks like every one of you are getting the correct answer of 1.1 mil. I did see one answer that was not 1.1 mil. But let's see if we can answer that real quick. Is the answer. So what we're looking for, remember, we know this is a reconstitution because it's intramuscular, so we know we're looking for ml. The only thing they tell us is that it's 1 gram. So that's your clue that you need to look in the instructions. The instructions we're looking through, and it tells us add 2.5 milliliters, shake well, gives us an approximate volume of 3 milliliters, and then this is what we're looking for. It tells us the concentration, but small in the whatever it's called, small in the label in the the instructions. Once you find that, you're going to take your 375 milligrams, your order, over your available times your quantity. And then you get 1.1 something, but we're just going to round that to 1.1 mil. Yeah, and if you accidentally flip the numbers 330 over 375, now you know, remember, it's always order over available. Or if you're doing dimensional analysis, then you would do 375 times 1 over 330, just to kind of remember that your available is typically what you're dividing by. Someone asked about an insulin question, so let me see if I have any insulin questions. I think that's usually just can you just read the scale? So give me 1 second. Let me pull that up. All right, here we go. I'm going to add this. So I got confirmation that this one is 1215. So if you come back to this 1215 ml or 1.215 liters, but you probably want to be very specific with your milliliters. All right, let me create this question here. All right, so for when you're dealing with insulin, it's going to give you some things. So some of it might just be mixing. So you're just going to add the two together. And then I think what they're testing you on this type of question is, do you know how to mark the syringe? So if it gave you 10 units of one type of insulin and 20 units of another type of insulin, can you mark 30 units on the syringe? And then for this is doing what's called a sliding scale. So the patient's in the hospital and they're adjusting their insulin levels dependent on what their blood sugar readings are. And so it says here, client's blood sugar at noon was 365. So then you just look to see what insulin range that falls into. So that falls into this one right here. So how much insulin should be administered? For this one, it would be 10 units. I should write 10 units. So insulin's pretty straightforward. It's just where this gets missed sometimes is I think sometimes you like read the number too quickly and you're like 305 and you're like, okay, 305, 8 units, but it said 365. So just take a moment. Remember that number is going to change on your actual test. So just make sure you read what number it is that they're asking you about. Let me just make sure I didn't miss any other quests. Okay. Yeah, so for mixing insulin, it's just, can you add the numbers together? So 10 plus 20 would be 30, and then you would mark it on the syringe. I don't think that it gets any more like bizarre beyond that. I don't know that I have any other samples of that, but let me just double check. Because next year you'll get insulin infusions, which is a little bit more challenging. But let me just see if I have any adding insulin questions. Yeah, I don't have any examples of mixing insulin. So from what I understand, though, it's just a matter of if you have one insulin type, like you're adding NPH to regular insulin, then they're both going the same syringe. Procedurally, you need to know that you draw regular first, then you draw the non-regular. So whether that's Humulin N or NPH or whatever it happens to be, and then you want to make sure you're at your total number. At Allegheny campus, like if you go through some of my reviews, they have to mark a syringe as if it has been filled. But to my knowledge, that's not something you have to do. So I think you should be okay with mixing insulin. I think it's just a matter of adding the two numbers together. All right. Well, like I said, this will be posted and available to you all on YouTube later today, probably this afternoon or this evening. And then I will, if you have any questions outside of this, or you want to kind of change a couple questions and ask me like to verify an answer, you could always email me. Just give me time to respond, meaning don't send me things on like Sunday night or Monday thinking I'm going to get back to you early on. I would say if you look at it the rest of today, tomorrow, I have some time in my schedule on Saturday where I should be able to respond to emails and answer questions. I may be able to respond to questions come Monday, but I don't know that for certain because I mean, it's, you know, a lot of people are off that day. I have a half day scheduled for that day work wise. So I'm just giving you feedback on that way, just to set expectations and then just to be patient with me if you send me a question. But otherwise, go through my review videos. I think that'll be helpful. And if I don't hear from you, good luck on your test. And I hope you do really well, and I hope you have a great semester. You're welcome.